Okay, so my very special guests today, Dr. Bob and Susan Goldstein. They don't need any introduction on these circles, I know, but I feel like obviously I'd be remiss not to say. Welcome, guys. Welcome to the show. Thank you so much for joining me, honestly.
Great to be here, Chris. Yeah, good.
So those of you who don't know, Dr. Bob and Susan are the co-founders of Earth Animal over 40 years ago now, 1979. And I don't know two people on the planet that are as committed to the overall well-being of the animals, the people, and the earth in general on the whole planet. It's the whole thing. And, you know, it's infectious when you walk into this building and you're part of this wonderful company. Their passion for all animals, all Earth's animals, is really amazing. And so I've been lucky enough to know them now for many years. As you guys know or may not know, I'm a small animal practitioner. I've had my own practice for 25 years, and I've been lucky enough to work with them almost from the beginning of my practice. It goes back quite a time. So I not only know them now as the the creators of this wonderful company, but I know them personally, and I've known their animals, and I've known their passion for this health and wellness of our little furry family members, right? And they've really committed themselves to creating innovative products and doing things another way, which really carries through this whole company. So, guys, I'm super excited about today.
Yep, great.
Thanks very much, Justin. Dr. Fritz has actually been our family veterinarian for many years. After Bob and I sold our physical hospital, he became our veterinarian, and he's just been an amazing support to our own animals.
Well, thank you very much. And so we go back a while now. It's really, I mean, it's amazing how fast time goes by. And I've been I've been with the company for now a couple of years, which seems like that's flying by as well. So it's and I've been lucky enough to be able to join in a official capacity now. So it's been good. We've been doing this show now since March of last year. So we've quite a few shows under our belt, and probably none that I've been more excited than this one. So thanks, guys. Thanks. We've already got people checking in. Usually we say hello individually, but I think today it's already scrolling fast enough. I'm just going to say a general hi to everybody. Thanks for joining the show. Today's show, let's talk about it. So we want to talk tick-borne disease. Specifically, we're going to focus on Lyme disease today, but I'm going to mention a couple of other tick-borne diseases that we see in the area. They're all treated very similarly. May is Family Wellness Month and Lyme Disease Awareness Month. So it's one of the reasons why we thought we can do the show now in the middle of May. The other part of this is that obviously springtime, right? Ticks. Spring and ticks go hand in hand. And I find myself saying certain things now that I've been in practice now for over 25 years. And I find myself every year now saying things like, this is the worst tick year I've ever seen. But I have to tell you, it is true. Specifically this year, ticks are very hardy, right? And you get this, each kind of more mild winter that we have, you don't get the die off of ticks. So you get this influx as they're kind of coming out of their hibernation early in the spring. And, as I look deeper and deeper into ticks and kind of research it, there's amazing facts that you find. Things like, and a lot of people may or may not know this, but a tick can survive 2 years, up to 2 years, many ticks without eating, right? So think about how hardy they are, how long they've been around, and they're in certain areas of the country, the coasts, and now really disseminated through the whole entire country. Ticks are a problem, and there are a lot of them, and unfortunately, they carry a lot of diseases, and so we're here to talk about it. I think one of the beautiful things about my relationship with Bob and Susan is the integrative medicine that we are able to do at my practice. And I was trained classically in veterinary school, but they've really opened my eyes to the benefits of integrative medicine. I think if it really is of benefit to treat the whole animal and use multiple modes of treatment, right? And I think when you do that, you get better outcomes simply. So, so that's what we're going to do today. Excited about it. All right. So let's talk ticks. The most common tick-borne illnesses, and there are several of these, many of them throughout the world, but the most common ones that we see are the one that gets all the headlines, which is Lyme, obviously, which we're going to focus on today because it is the most common, okay? Caused by a bacteria, a specific kind of bacteria called a spirochete, right? Borrelia burgdorferi is the name. Anaplasma is another tick-borne disease that we see, and Ehrlichia. Two other ones, they're all passed to our animals, to our dogs, when a tick attaches and takes a blood meal, okay? So it's spread from that. Depending on the different studies that you see, it does take generally several hours, up to many hours for some, to be transmitted from the tick into the animal. It can take quite some time. So, obviously that goes back to when you have your animals and you're out with them and you're hiking and they're out in the yard, it's always good when you get in to tick check them, because even, sometimes even if they attach, but they really haven't taken a blood meal and you can pull them out, you have a much better chance of not having disease transmitted. Okay. So it's, it's always good. And obviously some dogs are harder than others. If you have these, big long haired, dark coated dogs, it's not so easy to find these ticks, and Bob and Susan, one of the things that I always tell people is, they'll say, if we diagnose a dog and we say, okay, we found a tick-borne disease, a lot of times they say, well, I didn't see any ticks. And my whole thing is, it's not the ones you find, it's the ones you don't, right? These little deer ticks are tiny, right?
Yeah.
They can get into an armpit or anywhere behind the ear, and you may not find them. So it's sometimes difficult.
Especially if it's black poodle.
Yes, right. Yeah. I mean, with Jack, I think, he's got such a dark, beautiful coat. It'd be tough to probably find some ticks it would be not easy, easy.
Challenging.
So anyway, Lyme disease and tick-borne disease, for the most part, is a disease in dogs. There's always this debate. It's certainly cats. There have been people that said that cats don't get any tick-borne disease. As far as Lyme disease goes, I've had my doubts on that, but it's certainly rare if it is, right? And I've had cats that have come in and have had swollen joints, and you treat them and they improve, but there are a lot of people that cast doubt on the fact they can get it. However, it is primarily a disease in dogs. And I know, Bob, like when you were in practice too, I know every year, like it just, I see more and more of it.
Absolutely. Yeah, absolutely.
Yeah, it's really, it's unbelievable. Like I just, as a little side, I had 4 positives yesterday, just in bloods I got back from the day before. Yeah, and these were all Lyme, but we're seeing even, in this area of the country, and it's, the weather has now gotten beautiful here. So people are out, they're hiking, the dogs are out, and the ticks are ready. They're ready to get a blood meal.
Right. And beside the weather, which, is allowing more ticks to survive through the winter where they used to die, during the freeze off, after 35 years of chemicalizing these ticks, they're now called really the super tick and super flea, because they have mutated in such a strong way based upon being bombarded over the years with very strong chemicals. So these ticks are much stronger than they were when I was practicing in the 80s.
Liken it to the cockroach that could live through nuclear war.
Right. And absolutely. And and how many times you have people that used all the kind of the first iteration of spot-ons and things that, that said that they worked and, they worked on their animal years ago that aren't working at all anymore. Because they're developing a resistance to these things because, like you said, they're really hardy to begin with, but now they're very hardy.
Very
right.
hard. Yep.
Right. So what I do, and as far as, how we diagnose this, right? So, the first thing is we see, we on an annual basis and sometimes twice a year on animals, we always run heartworm tests, right? We want to make sure that animals don't have tick, those are mosquito borne, but we've actually gone a step further now because I find way more tick-borne disease now than heartworm disease, right? So we have what's called a SNAP test. It's an ELISA test, okay? And it tests for the presence of heartworm, Lyme, Anaplasma, and Ehrlichia. Okay, so I run that as my yearly and twice a year heartworm test on these guys because again, I think it's important to kind of cover our bases and make sure if these guys early detection is key, right?
Yeah.
And whether or not we do that routinely, but what are the signs that these guys will show if they are infected, obviously, with any of these, and specifically Lyme disease, right? So the first one is they don't always have signs, right? So this may be subclinical in them. They may just come in for their annual and we find it on that, which is often the case, okay? But sometimes we get them in where we get phone calls and says, look, my dog all of a sudden is limping. Limping is the kind of key, sign that we see in a lot of these guys. Sometimes it's intermittent, right? Where they'll limp on a front leg, say for 3 or 4 days, it goes away. And then all of a sudden another leg crops up, right? So that's very what they call pathognomonic. You see that often with Lyme where they'll have a few signs and then the owner will watch them over a weekend, they get better. They think, oh, maybe they strained something, right? And then on Wednesday it crops up and front right was the front right, now it crops up in the back left, right? So it's so certainly, lameness is a big one, right? Depression, that kind of, that ADR, that ain't doing right, right? That we talked about, just not themselves, general malaise, feeling down, maybe not eating as well. Fever's another one that's hit or miss. They can have a fever, sometimes they don't. And then there's the more rare signs that we see where they can have neurologic signs, some organ dysfunction. Lyme can really attack any of the body systems. And I think we're really going to talk about that later, right? On how we can kind of treat the whole animal. And I think that's really the reason why you want to, these get in them and can affect all their body systems. So I think you want to take it as an approach and where you treat the whole animal, right? Which is often the case. All right, so diagnosis. So we want to do these SNAP tests. We find them on SNAP test. They can also run now what's called a C6 level. So if we find a positive Lyme, we then do a C6 level. And what that does is it gives you a level that it can show how high the concentration or not is. And on the C6, they have a level of 30 on the C6 that they consider over at clinical, okay? And now I will tell you, and Bob, you and I were talking about this a little bit yesterday, that the way that I treat, so we'll talk treatment, when I see these guys, the first time that I get a positive, whether or not the C6 is over 30 or under 30, the first time I see it, I treat them, okay? And I think that's important because as we now know, which we didn't even know even a few years ago, they didn't really, this is relatively new over the past several years, that we do know that these can lay latent in animals' tissues for a very long period of time. And so to me, whether or not you get a, what you would call a clinical level on the C6, we've been testing this animal. We know this is the first time we're picking this up. And it's really important for me to get in there and treat it. And again, like we'll talk about, treat the whole animal so we can really help this not take a foothold in the animal, right? So conventionally, we treat with doxycycline, okay? The typical course is 4 weeks of doxycycline. We do it, one of the things about doxy, and we're going to get to this with Susan, Dr. Bob, but one of the things with doxy is we do, which is different than in people, actually. I think in people, they want them to take it on an empty stomach. We give it on a full stomach because it really can wreak some havoc with the GI tract, right? So full stomach, 4-week course. And then what we'll do is oftentimes then we put them in for a reminder, and 6 months later, we do another test with a C6 level to make sure that we see that level come down, all right? And no matter what the level is, your goal is to have that come down by half at a 6-month mark. So that's kind of our goal on that. And, and like I said, over the years, Bob and I, have worked together on the integrative approach. And I definitely give the floor to you on that, Bob. So we could talk what else we can do.
Okay. I
And you know what? That's such a dance when conventional and holistic come together for the greater good of the animal. It's really quite magical.
Yeah.
The synergism is powerful.
Well, it's almost greater than the sum of the parts, isn't it? That's the thing. It's like,
Precisely.
Yeah.
it really is when you start to have things that mesh together and you are doing this, like you said, synergistically, the outcomes that just bring a smile to your face because you can
Yeah.
see how they went. And I just, to me, and that was something, like I said, that I really learned as I went and from you guys, just to, because, unfortunately, I didn't get much of that in veterinary school. They just said, it's Lyme, doxy, that, there you go, right? But when I was able to,
The company and the fact that you kept an open mind
Really.
was very special in the early days.
Really.
well, I always tried when I got out of school, I was always, I think I always took the tack that if you're not open to things, if you're closed-minded, it's the worst thing that you could be in on any side, any side of the coin, right? So, anyway, so what else, how do we take the integrative, Dr. Bob?
Well, I think that you said something right in the beginning, which really is probably the foundation of the integrative approach. And I think that there's a number of studies that show that when dogs get bitten by a infected tick, 90% of them do not develop the disease. 10% develop the disease. The difference between those two animals is really the basis for the integrative approach. It's the animal's immune system that is in gear that prevents that 90% from coming down with the infection, and the 10% are the ones that are compromised. And in those, that you're going to wind up with a active disease. So that really is the basis. So focusing on the immune system as part of the treatment. We're not, as an integrative veterinarian, not against the use of antibiotics. Obviously, using something like probiotics along with it to protect the microbiome while you're doing it is important. We're not against that, but working on the immune system long range to make sure that the immune system is strong enough to prevent this thing from taking hold. Or the other thing that you did say right in the beginning is that this spirochete can go dormant and it can stay there for years. And then all of a sudden the immune system becomes compromised and boom, you're right back with a full-blown disease. So
Right.
from an integrative approach, that really is the basis. That's the common denominator, and that is the basis for it. So as an integrative veterinarian, if you came to me, I think there are two areas integratively that we should focus on. The giving of a Lyme vaccine conventionally, as a holistic veterinarian, I would be totally against. But there is a Lyme no-so, which is a homeopathically diluted Lyme disease. So using the no-so in a prevention setting to try to keep that immune system normal against the Lyme disease is something that I would be in favor of. And you can now get no-sos. They used to be prescription when I was practicing. You can get Lyme no-so on Amazon. So if you're concerned and you live in an endemic area and you want to prevent it, then certainly using a no-so would be good. So from a treatment, if you have an animal, what you said, Chris, was right. First thing is, if it's the first time, you really have to use antibiotics along with probiotics just to make sure that you just knock this thing out and get it knocked down to a point where it's not causing any problem. If you're against antibiotics and you really want to go after a natural approach, there is a homeopathic remedy. And that homeopathic remedy is the one, and you can now get the homeopathic remedy. It's called Ledum palustri, and that is available. The one that I recommended when I was practicing is 200C. So that's the strength of the homeopathic. And basically, if you get that and you treat that animal as soon as you know the diagnosis, or as soon as you know that there was a tick there and you're concerned about it, you want to start that, what I would do would be to use that right away, do it like 4 times a day for the first couple days. Then for a week after that, do it twice a week. twice a day for a week. And then for the next month, do it once. And then after that, you should be okay. That is a very potent homeopathic that will knock Lyme's disease out. So that would be the way I would go. So the combination of using a no-soda as prevention and using the homeopathic as treatment is what I would recommend. Now, along with that, as far as preventing and protecting the body, I would use a joint supplement to protect the collagen of the joints, because as we know, the pain is coming from the joints. So, something like Canine Liquid Health would be great. The one I recommend is the Forte. It's a liquid form, highly absorbed, really works well in preventing the collagen and the cartilage. I would say that Chris and I are working on a super duper joint supplement under Earth Animal brand, and that should be hopefully ready to go by the end of the year.
I was going to say it if you didn't. I was
Yeah.
going to say it if you didn't. I was chomping at the bit to say it.
That would be our go-to. So I would certainly recommend that one is around. If you can't get Canine Liquid Health, bone broth, real good bone broth, not the human version, because the human version has onions in it, and onions are not good for the dog. So try to get a canine version of the bone broth, which is great for the joints. And then the one I used in practice was a product called Collagen Complex, which really, really does help to to protect the joints. That's really what you want to do. And I'm just going to look at my notes. And then the only other thing that I did that is more on the medical side is that I used more therapeutic doses of vitamin C. And so the one that I used was sodium ascorbate, which is a buffered form of vitamin C in a concentrated powder. So for a small dog, 500 milligrams twice a day, medium dog, maybe 1,000 milligrams twice a day. And then for a giant dog, probably 1,500 milligrams twice a day. So basically that, from a medical perspective, that as a veterinarian, I would start those processes. And the rest, I think that Susan, has the more of the over-the-counter, versions of what we should do along with that. So Susan?
From my many years of working at the Earth Animal Store and at Healing Center for Animals, I've had the privilege of working with herbs. Our herbs are grown in the Green Mountains of Vermont. They're organic. They are cultivated by a master herbalist. And we're very, very privileged to be able to go to the earth as a source of healing. Obviously, when you work with an herb, you don't deal with any side effects whatsoever. One of our concerns is unchecked pain. And as you know, everything's interconnected in the body. And if an animal is enduring pain for long periods of time, first of all, will also produce lethargy and depression. You really need to tackle the pain. And it's a good thing if you can tackle it without side effects. So Earth Animal has a lovely liquid herbal pain remedy that I've used over the years. But I specialize in treating the animal's emotions. Again, I feel very strongly that the best diet on earth, the best vitamins, minerals, antioxidants, phytonutrients, put the whole program together. But if there's chronic anxiety, if there's chronic depression, if there's lethargy, and we don't treat that, then we're never going to get a full body healing. And the benefit of all the other good things that you're doing will be compromised. So I always go after the emotions, especially with Lyme, and I recommend Emotional Balance. It's a flower essence, and flower essences are very gentle. They're liquid herbs. Our flower essences are cultivated on Mount Shasta Mountain. Thank you. You have one.
Look at that, right next to me.
They're absolutely unbelievable. So treat the emotions, and I think that will help to perk up the animal's energy. And it will help you also because you can use the flower essences. And remember that your animal is picking up your concerns. So how you feel, if you're feeling positive, if you're visualizing your animal healing, that will play a role in your animal's healing as well. So I recommend Emotional Balance for humans and animals. We do have another product. It's a liquid herbal immune support product, and I feel very strongly that a good vitamin, a wholesome, neutral food, a food which does not produce inflammation, a food that's loaded in phytonutrients, such as the one Dr. Bob is about to launch, or house launch, I should say. You know, a wholesome diet. But I've also had really good experience with families juicing, not just for Lyme's, but for all sorts of debilitating conditions. And we actually healed our golden retriever, Lee, the founder of Earth Animal, through juicing. And I recommend a juice with organic celery and organic carrots and apples for flavor, because you can actually help to alkalize the body, and celery really feeds the joints. So that's my program, Morning Glory, but it's a great way of empowering families to be more organic, and it works.
Well, I think I just want to go back to, sorry, Bob, I just want to go back to when we're talking about the immune system and how big a role, like Bob was saying, that the gut plays in the overall. I mean, and this, as we started to learn more, myself included, learn more about the microbiome, you know, and talking about, so the microbiome in the intestines is, you know, the collection of microorganisms that live in the intestines, and 70% of our immune system is housed there. I mean, that's amazing. So if you can really regulate the gut and have less inflammation in the gut, and when you're on treatment to minimize impact to the gut, it benefits the entire animal. I mean, some of the studies that they're doing now that I saw a study out of California where they are actually seeing the microbiome affecting anxieties, to your point, Susan. So, and literally, you know, I mean, no one humanizes pets more than me, but the fact of the matter is that, you know, I talk to them all, but I think, they really, you know, they're really finding a basis that the gut drives so many different things, and even emotions in our animals, you know, and to see these, they really do think that they can impact, that they can, by feeding a better food, by having, you know, a better environment in the intestines, they can significantly decrease anxieties and separation anxieties and fear aggressions and things like that in our animals. And that's huge, because that's something that years ago most people weren't talking about. And I think the fact that it's becoming more and more mainstream, we're learning more about the impacts of our GI system on our overall health. And again, going back to what you're talking about a quality food, you know, we're in the middle of doing a microbiome testing with our Wisdom food now, and you know, with good early results, just to show that when you feed a wholesome food without a lot of byproducts, a non-inflammatory food, a simple food that's so healthy, it can really impact the overall health and it's not just physical, mental as well.
Right.
I think I just would like to reiterate what Bob said. It's so important, if your animal is on long-term antibiotics, to protect the gut with acidophilus. And I recommended any probiotics. I recommend it for any time an animal is on long-term.
Yeah. Now, I'll just add one more thing. Just one of the basic tenets of why we founded Earth Animal in the beginning, you know, in the 70s to begin with. As a holistic veterinarian, that was pre-integrative. I was a holistic veterinarian. We are philosophically opposed to using the animal's body as a delivery system for a poison to kill a flea and a tick. So that basically, based upon that, we created a natural program. And there are a number of companies that have natural programs for the prevention of fleas and ticks. And I think that the one of the call letters of the holistic movement is that if you can prevent something, you don't have to treat it. So if you can put together a prevention program for fleas and ticks that doesn't cause the body any harm, like a strong medication and like a strong insecticide, and you can prevent the flea and tick from really biting the animal to begin with, you've created the best prevention of Lyme disease. So that was
Also, you know, I know, Chris, we've all seen too much cancer in our own family and in our practices. And I think that the time has come for us to be aware of what the triggers are and to eliminate them. So the process of eliminating a pesticide and insecticide, which are known carcinogenics, is one way to to get a grasp on cancer. And I think that, the most of the products that are out there are highly carcinogenic. And we take issue with that. You don't need to be using a product like that when you can go to the earth and source an organic product. And I just think that that's something we need to be very conscious of.
Well, I think too, one of the things that I always say, and when people talk to me is, if you can do something naturally and it's effective, you can't argue against that, right? Why wouldn't you? If you can use a natural product that is effective, I don't know what the counter argument would be why you wouldn't use it, right? I mean, it just totally makes obviously common sense. And so, and obviously, like, we're always looking to make our system, and our programs more robust. The Nature's Protection is a multi-step program that works again in that symbiotically, right? When we have orals, we have internals where we work from the inside out, and we have topicals, right? So it really is something that, the other thing, I think sometimes you get this counter argument that, the traditional flea and tick medications, which we do know, and there's no secret to this, that the traditional flea and tick medications across the board are neurotoxins. They're meant to hyperstimulate the parasites, and that's the way they work. But they're obviously, like you said, they're going through our animals to do that. And, obviously the efficacy of these things are very high because they're very potent chemicals, right? But, and when we start talking about natural products, you typically can't get the natural products to that exact height, but you can use these systems to get close and also minimize the impact that you can have on your animals. And to me, I think that's important. And it's also important, like you said, I mean, when we talk about, and you have me saying we're all earth animals now, and I use that all the time, right? But it's true. And I tell this story too, back when we did, when really the only game in town, the new game in town was the spot-ons, right? Back in the late 90s and things. And at that point they were relatively new, and I was a new veterinarian, and people asked me to put it on for them, right? And so I, all day long, was putting on these spot-ons and getting it on my fingers and everything else. And my family would remark, if we were outside, like in the backyard at a picnic, or we went on a hike and everyone had like ticks on their pants or what, I never had anything on me. So I thought to myself, this is probably not good to be doing this all day. This isn't, if a mosquito won't bite you at all, then I don't know. You really, so I
like to think that your blood is vitaminized.
Really?
Yes, well,
that's the reason behind it. I mean, I still run across, animals that don't get ticks and don't get fleas, and people like scratch their heads and say, why is that? And I say, well, your animal has a strong immune system, and
right.
and these insects just, they really don't. They look at the vulnerable. They seek the vulnerable.
They seek the vulnerable. Yeah.
Well, and it's the whole point behind our internal powders that we do now in the internal system is to make their, to use those to make their animal less attractive to the biting.
Yes.
It's distasteful.
And one more thing I wanted to say too, Bob, from my standpoint, where you're talking about the chronicity sometimes and boosting the immune system. For me, once we do treat those animals and once we treat them at the beginning, I will not initiate treatment again unless we see obviously some virulent return to signs, okay? Or the levels really jump up or the animals get sick again, either from a new infection or a relapse of the old. These animals will come up positive many times, sometimes for life, but oftentimes for a very long time once they come up positive for Lyme.
Right, and that's where the no-soda is really, really good. There's as I said, you can now get them on Amazon. The one that we used when I was in practice was one called Lyme D, and it was incredible. And we put literally hundreds of animals on it. And it really just boosts the animal's immune system specifically to help prevent the bite of a flea or tick. Oh, not a flea, of a tick.
Right.
So
Right.
good.
Well, that's great. So you guys will, I think we have time. We'll take just a few questions. I think if you're asking questions, Remember, next week, we're going to do our Ask Me Anything. So if I'm going to try to take some on this topic today, if we can. Well, I see Susanna's up here. We'll take Susanna. So Susanna says hi to everybody, and asks what we recommend for flea and tick prevention that's natural. This will be an easy one. But this is a good point, though. And then in parentheses, she says, I don't want to put chemicals on Scout with his seizures. Okay. And I think that's a really, really good point and a great question to begin with, because the biggest no-brainer of the use of natural flea and tick, and specifically, Susanna, I'd be remiss if I didn't recommend the Nature's Protection. I will tell you, I have seen other lines come through my clinic of natural flea and tick. And I'm not saying this because I'm with the company. I firmly believe that Earth Animals is by far the best natural product. It's, again, there's multiple things, they go together. They do that symbiotic relationship, and they give us, they give you more potency through that. So Nature's Protection Earth Animal, you can get it at, at the Earth Animal store, at your independent retailer, and online, earthanimal.com. But seizures, so let's talk about that. They say, so we have traditionally now, you have collars, you have the spot-ons, and you have orals, that with the advent of orals that have come the last few years, okay? And on the orals, right on the boxes, they say, if your animal has seizures, you cannot use these products, because these neurotoxins can lower the seizure threshold. And in some, and we know some animals that have never had a seizure can have seizures on these. So if you have an animal that's ever had a suspected seizure or any, or known seizures, it's an absolute must that you would want to go to the natural products, because these neurotoxins can hyperstimulate your animals neurologically, right?
Yeah, and cause seizures.
They can cause seizures as well.
Right. Right. So I think that's, and when we talk about, we always, we talk about the term reducitarian, right? And we've always said that. And I think it's important. I think, if anybody's, if you're, there may be room to ease into these things and combine and try to lower the amount that we're using. Because sometimes, okay, we get it. We're in high tick, really high endemic, like here, high endemic areas. But there are ways, natural products are not going to exacerbate, if you can limit the amount, even limit to start and limit the amount, and then move into these. And as you get comfortable with using these, it's a good start. It's a good start. It's better, so I think that's also something to think about. But Susanna, Nature's Protection, I firmly, without a doubt.
Yeah.
All right. Let's see. Stephanie says, my St. Bernard rescue came with Lyme and Ehrlichia. Yeah, and it's not, and heartworms. So that's 3 out of 4 on the SNAP test, right? And I do see that. So, I've had 4 out of 4 sometimes. And, because a lot of our rescues now come from down south, where these things never go away, right? And that you've got mosquitoes, fleas, and ticks all coming at them. A lot of these guys are roaming the streets. So, so they come up, and you go to, and you get them checked out, and they come up positive. And, you're asking about long-term health management. I think certainly Bob answered a lot of that. Anything else you would add to that, Bob, or just that program as far as you want? It's the immune, right?
Oh, definitely the immune, and the St. Bernard has gone through the therapies for the condition.
She didn't say. So Stephanie, if you can let us know if we've already gone through the treatment for the heart.
Well, certainly general support of the immune system, with a neutral diet, obviously with probiotics for the intestinal tract, and any of the vitamin, mineral supplements that are food derived, that are really natural, that really give the animal everything they need is what I would do. But that animal probably should be on an immune modulating something also, like Immune Boost would be great for that animal.
Great.
And frequent blood testing to see if there's any organ dysfunction.
Yeah.
And then a therapeutic vitamin program for that organ if it's affected.
Yeah, and and one of the things that over the years that I've really tried to move towards is really focusing on the overall health and well-being, other than, so I'm a I'm a firm believer in doing overall blood tests. A lot of people say, well, we don't start those till they're, till they're mature animals. I'm a firm, I've created actually a couple different overall blood panels that I recommend. It's really the panels that I do now are really not much more financially money than if you're running a fecal and a heartworm test or a urine and a heartworm test, but it gets us complete blood counts, full chemistries, a thyroid, the SNAP test for everything we talked about, plus it gives us a reflex C6. So, and any urinalysis or fecal. So to me, your primary focus that I try to do is on the overall health from an early age. And this is another thing that I really always picked up from you guys that I've really just, I've kind of made it my own, sorry, but I always say every animal is an individual, and they are, no two pugs are the same. They're all in different circumstances. They have different underlying immune systems. They have different health, challenges. So you have to take every single animal as an individual, because I don't think there's one program that's the same for anybody, really.
Yeah, absolutely. That's why the blood is so important.
It is. And that's, Bob, what we used to do when Bob and I used to work on blood together. And what I would do is I would take blood and I would send it to Bob, and he would look through it, and he could create custom protocols for our animals. So, and he used to do it for the animals in my practice. And so we always used to work together on that. And I would look at a blood work and everything would be in normal. And I'd say, it looks pretty good. I sent it to him and he would go, wait a minute. He would look at and always, and no, but it was a really learning experience, because there's a difference sometimes between normal and optimal, right?
Yeah.
I remember we'd have suboptimal. And so it was just even taking those simple blood tests and delving deeper into the health of the animal was really cool.
Yeah.
Well, that's called nutritional blood testing, and I only hope we can market it to veterinarians one day.
Yeah, hopefully.
Talking about it, right? We're talking about it. That's something, I always believe was really good and and even ahead of its time, really, so I mean, and just how effective to custom make something for getting back to the principle of individualism, right?
Yeah.
Very cool. All right, I think we have time for a couple more. We'll take a couple more here. Let's see who's. All right. So someone was asking about ticks finding vulnerable animals, and just wanted to clarify that boosted immune systems are beneficial in that. And I think absolutely. I think, the stronger.
Yeah.
I'll have animals, say, take two dogs in a house, okay? And you'll have the 14-year-old dog that's got, Cushing's disease and some other challenges and disseminated arthritis and things like that. And then you have the 2-year-old that's at the peak of their health, and they'll be in the same environment, and they'll come in and I'll look at them, and one will have some ticks, and the older dog will have fleas all over it, and the younger dog has none, and they're in the same house, right? And I think that is really where you see a testament to that, because that mature animal has a harder time, fighting those off, and that they're immune challenged at that age.
Yeah.
All right, let's see. All right. Okay, so here's a question that someone was asking, and then, all right, we'll take this as our last one. Here we go. It says, and this is just going to heartworm disease, but we've been talking about it a little bit. How can I naturally protect my dog from heartworm disease? I'm about to adopt a dog after a decade of not having one, and I don't want to use all the chemicals to prevent fleas, ticks, heartworms, etc. So they're looking for a natural way that they can, approach it.
Well, I think there is no natural product that is 100% effective against prevention of heartworm. So, but you can, and many of my clients, I gave them the choice: either go on heartworm preventive medication or get that immune system as strong as you can, which will give you equal protection. And then what I would recommend would be probably take the heartworm test twice a year. So
Right.
if heartworms are developing, you catch it so early before there's any secondary effects on the heart. But I would recommend everything that they can do to maximize the immune system, get on a flea, tick, mosquito prevention program as quickly as you can. Just get on the prevention side of heartworm disease, and you'll be way ahead of the game. And then just test periodically to make sure if there is heartworms reported early. That's what I would do. In our 45, 50 years of practice, we have never, ever put our dogs on heartworm medication, ever. We have never done that, and we have never had a case of heartworm in all the animals that we've had over the past 50 years.
But we are faithful to testing twice a year.
But we do test twice a year.
And we do stay on the Earth Animal Herbal product,
Right.
and we do use the spray during peak mosquito hours.
Yeah.
Right.
And
And I
here-
do,
Spray. I'm
I
very,
actually,
it's a big responsibility.
But you got to be diligent, right?
yeah, you have to be, and it's a daily, and just being hyper vigilant about doing it, right? It takes it, a lot of times when you go the natural route, it's going to take some increased effort on your part. But again, it's worth it, right?
It's worth it. We
the other, let me take one more. Candace writes in, what is the best way to determine, hi Candace, what is the best way to determine if furry family member or human family member should get tested for Lyme's? Is it better to have, is it better to just test, or, and so my answer would be what we said before. I think with the animals, and I can't really speak on humans part, but I can say that to me, it's really just routine testing,
Yeah.
because again, they could be subclinical. And so to your point with the heartworm, and like I said, from what we see, routine testing and getting that SNAP 40X. And, if you're in high tick areas and your veterinarian's running heartworm test, antigen test, you can always ask to have that other test done. And I think it is important to have the tick aspects. I went to that test a long time ago,
Yeah.
and
Yeah.
of course it's going to be a little more expensive, but the fact of the matter is you're getting a lot of data. And again, I see way more tick positives than I do heartworm positive dog up here.
Yep,
Right.
yep. Where we are, yep.
Well, guys, thanks so much for doing this. This was great. I hope we could do it again relatively soon. I really appreciate it. It's fun.
That was good. Well, it was good.
Thank you so
Thank you very much for representing the animal the way you do. It's good.
So I want to say that we do at the end of the show, I usually do a quiz question. Okay. And then, and we give away a prize, right? So hopefully people are paying attention. I know, hopefully when I'm talking, they're not drowning me out and they're paying attention, but so we're going to give, for the quiz question today, we're going to give a copy of your book. All right. And I did ask a signed copy if you guys would sign it for the person getting it, right?
Yeah, we go.
Again, we said May is Family Wellness Month. So why, this fits in perfectly. This is a great book. And I refer to this book all the time. I mark it up with a highlighter. I'm sorry, but it's my copy. I can do what I want. But when I talk about these things on the show, I refer to that book all the time. So it's been great for me, and it's a great read, and there is a lot of good information in there. So we're going to give a signed copy of the book away. And I thought, again, since we have it on here's the quiz question. I mentioned it earlier today. What year was Earth Animal founded? So that's our first person in the continental United States, first person to just come up on our feed with the answer of the year. All right. And while that is loading, I think, the other thing I want to tell people is if you enjoyed the show, Jennifer got it already, right out of the gate, 1979. Jennifer, good job. You win the book. You win the signed book. Nice work. I just want to, if you like the show, as we talk about, please like it, share it. We're really building a community here. We're having these great discussions on a weekly basis, and obviously I couldn't do it without you guys. So I really appreciate everybody's input, and the questions have been great. And next week we're going to go back to Ask Me Anything. I want to thank the Goldsteins, obviously, for taking their time. Now I know it's been a long day for you guys. You guys have been busy all day, and now I mean, you probably haven't even eaten yet. It's 7 o'clock. So thank you very much for coming on. We're going to go out with a song that I think the two of you also might enjoy. I did a little research into it. So, all right.
All right, great. Thanks.
Chris.
Thank you.
Billy Joel to go out with, right? Bye, everybody. Thank you. Have a wonderful weekend. Enjoy the nice weather. I'll see you guys soon, obviously. All right.
Take care, Chris. Thank you.
Bye, guys.
Bye.
Bye.